You wake up, and before you even open your eyes, you already know. Your tongue is stuck to the roof of your mouth, your lips are cracked, your throat feels like sandpaper. And the first thing you do, even before you check the clock, is reach for that glass of water on your nightstand, because you already knew it would be there. You put it there on purpose, every single night. Most people think, I guess this is just what getting older feels like. But as a physician, I'm here to tell you, waking up like this is not a normal part of aging. It is a specific biological signal. I'm Dr. Megan Foster. In over 20 years of clinical practice, I found that in 80% of cases, chronic morning dry mouth, medically known as xerostomia, has a specific reversible cause. Today, I'm revealing the 5 hidden reasons why this is happening to you and how to fix it before it leads to serious dental decay or sleep issues. Let's start with the most common culprit. It surprises almost everyone. Medications. There are over 400 common drugs that list dry mouth as a primary side effect. Blood pressure pills, antihistamines, antidepressants, and even bladder medications. Saliva is controlled by your autonomic nervous system using a chemical called acetylcholine. Many of your daily pills block this signal. They literally tell your salivary glands to shut down while you sleep. According to the Journal of the American Geriatric Society, if you take 3 or more daily medications, your risk of chronic dry mouth triples. Stop right here and do me a favor. Look at your medicine cabinet. How many prescriptions are you currently taking? Drop that number in the comments below. It helps me understand what our community is navigating, and I try to respond to as many as I can. The second cause is mouth breathing, and the third, which is much more dangerous, is sleep apnea. If your nose is congested, your body switches to mouth breathing. For 8 hours, air moves across your oral tissues, evaporating moisture faster than you can produce it. But if you wake up dry and exhausted or with a headache, we might be looking at obstructive sleep apnea. This is where your airway partially collapses. Your body gasps for air, stripping your mouth of every drop of moisture. Research shows that untreated sleep apnea in seniors increases the risk of stroke by up to 60%. Your dry mouth might actually be a warning sign for your heart. Cause number 4 is chronic dehydration, and it's not as simple as drinking more water. After age 60, your thirst mechanism becomes less sensitive. Your body can be running on empty, but your brain doesn't send the thirsty signal anymore. Studies show that 60% of seniors who consume less than 1.5 litres of fluid daily suffer from morning dry mouth. You aren't just thirsty, your glands literally don't have the raw materials to make saliva. This last one is the reason I never let a patient leave without asking about their eyes. Sjögren's syndrome. This is an autoimmune condition where your body attacks its own moisture-producing glands. It is notoriously underdiagnosed, often taking 3 to 4 years to identify because people dismiss it as just getting older. Listen to Patricia's story, a 66-year-old patient of mine. She'd been reaching for that water glass for 4 years. When she mentioned her eyes felt gritty, we ran a blood panel for SSA and SSB antibodies. It was Sjögren's. By adjusting her blood pressure meds and adding a targeted saliva substitute, she told me, "Doctor, for the first time in years, I woke up and didn't immediately reach for the glass. Here is exactly what I want you to do today. The medication audit. Take your list to your doctor. Ask them, can any of these medications be causing my xerostomia?" The sleep test. If you snore or feel tired, ask for a home sleep study. It is covered by most insurance. Targeted hydration. Set a goal of 64 ounces, that's 2 litres, a day, tracked in a bottle. Check your eyes. If your mouth is dry and your eyes feel gritty, ask for an ANA blood panel. Nightly relief. Use a mouth rinse containing xylitol before bed and avoid alcohol-based mouthwashes. They are like gasoline on a fire. One safety note, if you have trouble swallowing or unexplained weight loss along with dry mouth, please see your doctor this week. Now, I want to hear from you. Leave me one word in the comments: medication if you think your pills are the cause, sleep if you suspect breathing issues, testing if you're going to ask for a blood panel. Next week, I'm covering why you wake up at 3 a.m. and can't fall back asleep. Subscribe so you don't miss that. I'm Dr. Megan Foster. Take care of yourself. You now have the information to do exactly that.